Hello and welcome to Pisgah Health Today. My name is Angela Owen. It's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Michael Dexter Smith, who comes as the treasurer and the president-elect of the Brevard Rotary Club. Welcome to our program today, Michael.
Thank you, Angela. Thank you for inviting me.
Of course. Michael comes with quite an array of background and current experiences. He is the general partner with Pinebrook Ventures. He is a principal with Northeast Business Partners. He is a mentor with SCORE Brevard, which keeps him quite busy. He is the vice president of business development with Parabiotic Research and Development Corporation. He has a little company called Twisted Plastics, whose goal is to save the third world from the plastics. And I'm not sure when you sleep or eat or any of those other things, but we are super excited that you're joining us today to talk a little bit about your work with the Brevard Rotary. So why don't you start by telling us just a little bit about that?
You know, Brevard Rotary, thank you, Angela, for that introduction. Gosh, it does sound a lot when you get down to that level. I also have a software company called Extreme Soft as well, which is sort of the principal. But, you know, we're a small but mighty club. We're a small, less than 20 people. We are part of Rotary worldwide, and that is 1.2 million members in 32,000 clubs across the world. And I've been to at least 10 of these clubs around the world. Nepal, I've been to a couple of clubs. We built a school out there with the club out there. And I went to Puerto Rico on a mission, called the missions. I went to Puerto Rico to help. Actually, we demolished houses. It wasn't, we didn't rebuild them. We just demolished them. So it became a building site. So we took a hurricane situation and took it down to bare bricks, bare floors, basically. Our motto is service over self. I like to say community over self, so that we work towards a better community, just improving the community. That's what I'm all about. I enjoy doing that. I enjoy seeing the fruits of whatever we do. If we can change it a little bit, for a few kids, we do a lot with children. We do a lot in the middle order of life, and we also do a lot on the end of life sort of side with Alzheimer's and with polio, and perhaps I'll come back to polio a little bit later on. We run the ELVES program. We put a playground or a football field in at El Centro. We did the COVID program that we're going to talk about today, which was a lot of work, I'll be honest. We've just bought a school bus, and we are going to equip it. They've stripped it all out now. It's going to become a magic school bus, magic book bus. I'm sorry, I won't say school bus, magic book bus. It'll serve the Rosman area, and it'll be basically a mobile library. Hopefully we can get Wi-Fi onto it as well, so that it can be a hotspot for the kids down there as well. We do scholarships, and we try and help wherever we can in the community, and often it comes down to, you know, if not us, then who? And you know, we're kind of a fallback volunteer organization for a lot of things that go on in the community. All of them are absolutely wonderful. We have a lady that does some Baldrics for cancer patients, kids that have got cancer, and does a wonderful job there. The ELVES program is incredible. Catherine Chapman runs that for us, and we get one card. So 350 people in care homes, each one gets a card every month, and we get these lovely letters back from these people saying this was the only card I've received, you know, in a year. And it's like, oh my goodness, you know, it's just shocking. These people are parked essentially in some of these homes. So we try and do that. And just be community oriented. And I think I also run a MOI with Blue Zone. So, you know, we've got 22 people in my MOI, and we walk around towns. Come join us on Friday mornings at 9 o'clock at the depot. You can come join us down there, and we'll walk around town, see the town. There's a little bit of background on we obviously run the races in town, and we've got the last one that's up and running now is the Flight of the Vampire, and that's basically they're our money spinners. Unfortunately, this year has obviously lowered the numbers. We instead of 600, we had 60 run some of the the virtual events, so we're down by a factor of 10. But we keep running them, and next year hopefully we'll be back to 600 in each of the races. That would be lovely. So we do quite a lot in town. We're quite busy boys, to be honest, and we like it that way. We're a cause-based organisation. We want to. We're not, we don't want to be a network. We are a networking organisation, but our primary focus is delivering services and just improving the community generally.
It's incredible to hear the spectrum that you touch with all of those different things that you have in that relative of service, or that realm of service and community help along the way. You mentioned briefly this little COVID project that was very intense. So draw us in and help us to understand, how did the grant that you received from Pisgah Health Foundation help you in serving the community?
Well, let me look back first. I was probably the worst person they could have chosen for this job. I had no expertise in buying medical equipment. The extent of my medical equipment purchases was at CVS. I had no real medical equipment experience, so I really didn't know what I was. I wouldn't say I didn't know what I was buying, but I didn't know the nuances of some of those things. So I was sort of learning all the way through, and I got no contacts in the industry either. I got no contacts in the industry either. And last but not least, I couldn't read Chinese because so much of the stuff was coming out of China. In fact, I turned in the end. I would send the documents to a friend in Japan who had a girlfriend that was Chinese. She would translate them, send them back. That's how I learned what the heck were these things actually meant. So it was kind of it was a learning curve. So when I got given or asked to do it, I thought to myself, maybe I'm just number 34, and they've asked 33 people, and they all said no. Maybe that was the answer. But we were tasked with putting together a week's supply of PPE from an emergency point of view. So this was if we had a major outbreak at one of the care homes, one of the 6 care homes in the county, that we had a PPE emergency supply. And we sat down. They sat down with me a little, but really it was with the medical people, and said, what do we need? So they gave me a list of gowns and masks and gloves and so the list went on. We thermometers and oximeters, and I'll come back to oximeters in a minute. But so they gave me a list, and literally they sort of called me the bulldog, because there's no other way to do it. I just started calling and saying, what have you got, and when do you want it? When can you deliver it? We started in April. I think I started April 6th or 7th this year. We had $52,000 to spend. So Pisgah, as always, they have been marvelous just for the community. They've been incredible. Lex and his team have just done, and the board have done an incredible job. But where would Transylvania be without Pisgah Health? I just don't know. But they gave me 50,000. I got 2,000 from Rotary, so I got 52,000 bucks to spend, and they literally gave me a list of things that they needed. I called some names and numbers that I could find, and I realized just how little I knew about the shape and size of gowns and the thickness, and whether it was level 1s or 2s or 3s. And so after 2 or 3 calls, I was like, oh my goodness, Mike, you really don't know what you're talking about. And honestly, I didn't. The only thing that buoyed me a little bit was after about 5 calls, I realized that most of the vendors didn't know what they were talking about as well. So it was like the blind leading the blind, It's like, oh, well, what about this? Oh, I don't really know. It's like, oh, well, you got to know. You're selling it to me. Tell me what this product is. But it really was the Wild West. I think there was 10 times the demand of the product in the market. So that gives you an idea of what we were fighting against. I mean, price points for a gown ranged anywhere from $6 a unit to $18 a unit for a not dissimilar product, because people just didn't know. People were buying everywhere. People were buying vast quantities. I got beaten out a number of times by Veterans Administration, by some of the other government organisations. Now, I'm not saying they shouldn't have it. I mean, goodness only knows that our veterans need it. But you got beaten out. Here's me buying 1,000 or 4,000 or 5,000 units. They're buying 500,000 units. It's like I'm this little fish. But I started out with masks. That was my sort of the KN or the N95s. And to be honest, I called 3M, and the guy at the other end just sort of laughed at me and said, "Mike, maybe you'll get them in 2021." And I was like, "Well, that's not really what I was thinking about. I was thinking about this year maybe." And he said, "No, there's no chance that you're going to get those." So we went to KN95s, which is the product that comes out of China. I don't know whether I got lucky or not, but I found 4,000 or 5,000 units that were tagged on to I think a Veterans Administration. I don't know whether it was. Maybe it was I think a Veterans Administration order that was sort of excess, and purchased those. And everybody thought I was wonderful. I mean, it was so lucky. I mean, as I always say to people, though, you sort of create your own luck. So I suppose I'd called enough people that I'd eventually got the sort of the right way of trying to find these things. We got good masks. I always required that they send me a sample because I didn't know what I was buying. Some people just said no. You buy everything. I was like, well, I'm sorry. I'm working with the health department, who were wonderful to work with. I have to say, the health department just incredible here. And Rick as well was just amazing. They were amazing people. Elaine and Rick are just amazing people, and did so much more really than I did. But they would look at the sample that came in, give me a yes or a no, and then I place orders, and it, we tried to buy local as well. So I bought quite a lot from Pisgah Labs, quite a lot from Sylvan Sports. They were doing face shields. Pisgah Labs were doing wipes, because you just couldn't get Lysol wipes. They asked me for Lysol wipes. I said, "You're joking." They're just nothing's coming into the supply chain at all. I tried to pick reliable sources. I got 2 or 3. I must have spoken to 45, 50 different organizations. Most of them completely fly by night. Most of them were selling me product they didn't have, or trying to sell me. They didn't sell me, but trying to sell me product they didn't have. So, trying to look for reliable sources, good quality. Quality was always important. There's no point buying rubbish. And we got presented with total rubbish at times. Gowns without any arms on them. That was the best one of the best ones. Gowns where you couldn't get your head through the hole at the top. It's like, guys, what are you doing here? We had one, the best one was the thermometer that only read one temperature. So whoever you pointed it at, you clicked it, and whatever, 98.6. Well, I don't remember what we are, but that was the only number that came up. I was like, okay, that's different. It was cheap though. God, it was cheap. But we worked through these things. I've still got some of the total rubbish in my garage. I'm not ever going to show anybody some of the stuff they sent me, but it was. Again, then the financial side came along. Most of them wanted payment up front, which I politely declined. Some of them wouldn't give me samples, and we politely declined them. And then the best one was always on the ocean. And we had the 2 situations, because I bought from China. We bought quite a lot of good stuff from Vietnam, actually. A lot of the gowns came out of Vietnam. And India looked like a good supply. They got good product. But they kept saying it was on the ship, and I said, okay. And now this was June, and it was supposed to arrive in 2 weeks in LA. And I said, well, when it gets here, tell me, and we might buy some. It wasn't until mid-September when it arrived. It was like, what are you telling me here, guys? Right. So we tried to get quality. We tried to buy it at a decent price, and I got some good prices. I must confess, I banged around, and I'm never shy of. My wife will tell you, never shy of asking for a discount. And some people just automatically gave it to me. It's like, oh, okay. I wasn't a medical professional, so some places were blocked to me. You can't buy unless you are a doctor or a dentist or something. But eventually we built it up. We finished up with the thermometers and the oximeters. And oximeters was an interesting one because I really didn't know even what they were for. I just saw them on the list at the bottom. It said oximeters 35 or 40 we needed. I thought, oh crap, okay, we'll leave them to the end because I really don't know what they are. And of course, they've turned out to be one of the best indicators of COVID infection, because if your blood oxygen level is below 94 on an oximeter, it's a good indication that your body's fighting something going on, fighting a disease of some sort. So in fact, they've become incredibly difficult to get hold of. You can buy them, but price points are going zooming up as people realize this is a very quick way of sort of giving an indication of whether you've got some sort of thing going on in your body. So, you know, we work through them all. I know more about masks and more about gowns and more about gloves than I ever wanted to. And I want to drain those brain cells, clear them out. You know, I'd like a reset on those brain cells so I can have them back for other things. But it was a project. I think at the end of the day, working with Pisgah was terrific. Obviously got the money. We bought. I did all the buying. So I was cutting the checks and the wires. Some people insisted on wires. So we were doing all the banking side of it as well. Gave them regular updates as to what was going on. And we now we've got the supply. It's all at the health department. The bad news is that we had to use some of the supply because we had some outbreaks in some of the care homes, which is disappointing, and some people very sadly died. So yeah, that's a tough side of the equation, but we tried our best. You know, we had the product there when they needed it, and that was the key, and what we were all chasing down. And again, everybody said I was going to be a bulldog, and I guess I was. And we got it done. We've left ourselves now in a good place. I can order, we can buy from reliable sources, which is the most important thing with these products, because you can get total rubbish sent to you if you try and buy low or buy from suppliers you don't know. But I've got a few pretty good suppliers with good quick turnaround. And hopefully, if we don't have another major outbreak in the care homes or within the community, because I'm sure they'd use it in the community, we should be in good shape. We've got this buffer supply now that's ready to go, and hopefully we'll save a few lives, which is I guess was the intent at the beginning of the day, that we'd got the sufficient and to keep the carers safe as well. I mean, some of this stuff was just. Was not of a quality that it kept a carer safe. So I mean, you can't have that situation either. So hopefully we did a good job. As I say, we got a little money. We've got all the product now. We're in good shape. Some of it's been used. Some of it, a lot of it is still waiting to be used, but we can. It'll store forever probably. So yeah, I think we did pretty good. As I say, Pisgah Health. I can't say enough about them because they are terrific people. The Department of Health was great as well. Eric did a fantastic job. I mean, we did modify the first list we got. He and I looked at as we went through, and I said, guys, look, I can buy some more masks. I found another place I can find masks, these KN95s. Let's take them now rather than waiting down the road, which was good. So we got, I think, 5,000 masks. We got 5,000 gowns, any number of gloves, and the like, and then thermometers, these no-touch thermometers, and these oximeters, which are proven to be very, very important. So if we can save a few lives, I think that was the goal, and I think credit to Pisgah and to Eric for thinking that we were going to need this stuff, because that was the foresight. I'm just the soldier. But the general saw the need for this product in case we had an emergency outbreak, and we got it now. So I think we're far better off than a lot of other counties that have not done what we've done. So congrats to everybody. It's not just Mike Dexter Smith that takes the credit here, but everybody.
Well, and just to highlight, this was a very proactive approach to help protect the most vulnerable in the community. And Michael, I applaud your tenacity in working through the technical challenges, working through the supply chain challenges, working through all of the quality challenges. Like, this was no easy feat, but recognizing, as you're saying, that the impact is really how do we protect and prepare those who are in the most vulnerable. And so that proactive team, you keep referencing the health department and Dr. Rick Emus and yourself and so many others who were on that team. So thank you for your leadership there along the way, and well done. They put the right bulldog in this to be tenacious.
The British Bulldog, huh? The British Bulldog.
In finding the solution along the way. So congratulations
Indeed.
on that.
Thank you. Thank you. It was a project.
Of course. One that definitely no one wanted to have to take an undertaking, but definitely one that was needed. So thank you for that. Michael, what else would you, I'm sorry?
I think in life, I mean, I'm 67 now. In life, you know, sometimes the things that come across your transom are not really what you want to do. You know, I mean, I'd rather be running little companies and doing lots of exciting things. And yet, I think at some point you've got to say, look, I've got to take my experience and apply it to something that does anybody else really want, or am I really just the right guy? Lex said to me a couple of times, you're just the right guy for the job, Mike. And I thought, oh, yeah, maybe I am, you know. And it comes back to my philosophy of, you know, if not us or if not me, then who? And I take that very seriously. I think that's an important community commitment that one makes, that you're going to try your hardest for the community, and I hope I try that. I hope I try and do that.
Absolutely. Michael, what else would you like our viewers to know about the Rotary Club and how they can come alongside and support you or get involved?
Well, we have a big event on Saturday. Saturday is World Polio Day. I'm not sure your listeners will know how much we've done with polio. You know, the polio vaccine, I think it was 1956, if my memory is recollects. And I was born in 53, so I remember polio, I'm afraid, very, very well. Had a very close friend who lived next door who died of it. So in 56, we got a vaccine. It was applied through the US. Cases in the US dropped dramatically, which was great, obviously. But then in 79, two Rotarians decided that they also wanted to try and carry this whole concept across the world. I think one year there were 360,000 cases in 120 different countries. I remember that number. I don't remember the year, but there was just this massive outbreak, and it is such a debilitating disease. If you see somebody with it, and if you ever want to look it up, there was a guy called Dave Clark. And he's not the singer, and they're not the singer with a Dave Clark 5 or whatever, but Dave Clark was a polio, was diagnosed with polio at 10 months, went through rehabilitation in New York for, oh gosh, I think he said 15 months or something. Came out, of course, not of course, but could not walk, had to use crutches. And it's just a wonderful story of willpower and commitment, and he became a minor league pitcher. If you ever look him up, he became a minor league pitcher. Would you believe? And it's just a wonderful story. I've met him in person, and just a terrific bloke as well. And he tells a story. I will tell you this story. He tells a story of they were having a class outing to the local fire station, and it was 6 blocks away from the school. And he had been absolutely panicked about this because he had to use his crutches to get to go with the group. And on the morning, his mom said he didn't want to go to school, like we all didn't want to go on the days that we didn't want to do something. He didn't want to go to school, so mom and dad pushed him along. They were wonderful people, pushed him along. And a friend of his, now this is at 9 years old, a friend of his turned up with his little red four-wheeler truck, you know, those four-wheeler things. And he said, "Come on, Dave, get in the back." And he pulled him all the way, and it makes me tear up. I'm a bit of a crier anyway. I apologize, but he pulled him to this thing, and I thought to myself, my goodness, that is so terrific. And it just is. Just his whole life has just been one of perseverance and doing great things. I'm sorry that went all the way wrong way around. But in 1979, we started across the world. 570,000 cases across the world, 120 countries, and we've put now, I think, $2 or $3 billion through Rotary into polio. And last year there were 4 cases, so we went from 500,000, 350,000, I think, cases to 4 because of the vaccinations that we did all across the world. And we've got teams going through India, Africa, the Middle East, and the only 4 cases were in Afghanistan and Pakistan on that border region, which is difficult to get to from a war point of view. But just been a fantastic project for Rotary, and sometimes you feel, oh my goodness, shall we move on to something else? But if we let it go, polio will come back. We will never kill it. It keeps coming back, and there's a lot of similarities, and we're actually using the same infrastructure for polio. We're going to use the same infrastructure for the COVID-19, the dispensing of the vaccine for the COVID-19. When we get a vaccine, we'll use the same channels. But it's guys on bikes with frozen backpacks, because they have to keep all these vaccines not frozen but chilled. And and you see them biking around, going to these little villages and vaccinating all these kids, and it's like, my goodness, that's us. And we really changed the world with that one. That one is a real game changer. But we have to keep going at it. We have to keep moving. We have to keep driving at it, because it is relentless. Relentless disease. All these viruses they'll just hide away. And when we stand back, if we're not vigilant, if we stand back and say, oh, it's all done now, it's going to come roaring back again. So I encourage people, if they got a chance, we're always looking for help, donations with that. So that's always important to us. The Alzheimer's research as well, I find fascinating. Some of the people, some of the researchers, some of what they're doing is amazing, and we're putting 2 or 3 million into that on a regular basis as well. So I think we're doing some wonderful, wonderful things. I love the community things, local community things. I love doing this COVID thing because I think we were making a difference, and I think that's the important part. If you make a difference in your life, hopefully somebody will look at you one day and go, yeah, Mike, you did all right. And I'm like, oh yeah, I did all right. As I said to you, I'm 67. I'm still wondering what I'm going to do when I grow up. I've got all these projects going on everywhere and trying to change the world, but still got to find what the change is going to be. Somebody's got to tell me what to do next.
Well, Michael, let me tell you that you are changing the world in so many different little ways. And so, thank you so much for the work. And on behalf of the Board of Directors at Pisgah Health Foundation, thank you to you and the rest of the Rotary, and to that task force that worked so diligently on this particular case of the rapid response relative to the COVID-19 and protecting our most vulnerable. But thank you so very much. Thank you for being here today and sharing a little bit of the story. I have a feeling we should have you back. There's a lot more to unpack there along the way. I'd love to tell you
about all my my twisted plastics and all the other things that we're doing, but some of the other things with regards to the AIDS virus, and I'm sorry, some of the AIDS virus and things like that. Some of those are real game changers. Whether I'll ever see it in my lifetime come to fruition, I just don't know. But you got to keep trying. You got to keep pushing the envelope.
That's right. So, well, thank you. Thank you for bringing that tenacity and the passion into play day in and day out in our community and around the world. We also want to thank Wildflower Media for their creative and technical support in putting together these programs, as well as the board of directors and the staff at Pisgah Health Foundation and the Physicians Roundtable, amazing people who are doing so very much to help the residents of Western North Carolina. Until we see you on the next Pisgah Health Today, let me encourage you to stay well, be well.